Hey there, I'm Dr. Barbara Woods, and you are watching the Intergenerational Trauma Therapist show. And today we're going to talk about navigating the depths of intergenerational trauma and a path to enhanced specialization. So, the question is, do you want to know how specializing in intergenerational trauma therapy can decrease your burnout and increase your client outcomes at the same time? So that is what we're going to talk about today. So if you want to become the go-to therapist for breaking these cycles of intergenerational trauma and elevate your therapy practice, you need to have specialized skills in healing intergenerational trauma. So in this video, we're going to learn the 5 powerful impacts of how specialization positively impacts client outcomes and a little bit of the therapist, because the better we do, the better our clients do. So first, we're going to talk about navigating the complexity of intergenerational trauma. We're going to talk about building credibility and expertise in your practice. We'll look at increasing referrals and client retention. We'll also talk about your own enhanced job satisfaction and identifying professional development needs. So, one of the huge challenges with intergenerational trauma is the complexity of the cases that you're going to be dealing with. And there's so many layered things happening that it makes it really difficult to know exactly where to start, exactly what's going to help the family. And it's complex because there's these layers are big all on their own. So the layers include the adult complex trauma that the parent or caregiver has experienced, the child's trauma experience or the teenager's trauma experience, developmental trauma, and how this impacts their development and how we can it kind of intervene so that there's no more developmental impacts and possibly even address the impacts that have been there. And you have to have attachment in there. So that's another very large field. And then you also have to have family resilience and some family therapy skills. All 4 of those areas are large in and of themselves and can be quite challenging just by their own nature. So when you have these all combined, when you're working with intergenerational trauma, it becomes a very complex, layered picture. So these areas also have different impacts on different people. Different families have different interaction styles, structures, values, culture, norms that all impact that complexity. So there's a degree of knowledge that's at a specialist level that's required to address this complexity for the overall family system to heal and to develop intergenerational resilience. So there's only 2 specific intergenerational trauma interventions that have been developed. One doesn't include current neuroscience and recent research, and that's why I developed the Intergenerational Trauma Program. It's the result of 14 years of practice, learning, and training, and then developing it to create an efficient and effective framework for treating intergenerational trauma and managing that complexity. So now we want to talk about therapists building credibility and expertise. And expertise is kind of a tricky word. It doesn't mean that you are established expert and you don't have to learn anymore. Expertise is a very high skill level, but we're always constantly learning. And being an expert in a subject area doesn't make us an expert on our clients' lives. Our clients are the experts of their own lives. So it's really important when we talk about expertise to have that mindset. So sometimes therapists struggle to establish themselves in as a credible expert in a niche field, especially one like generational trauma, because it's not really, well, there's no training programs other than the 2 that I mentioned. There's not a lot of emphasis, there's awareness, but there's not a lot of developed programs. So one way of establishing that credibility is to get a certification, and that will help you be recognized as an expert. In my opinion, training should include current neuroscience research, including polyvagal theory and relational neuroscience. And this is because co-regulation is one of the pillars of polyvagal theory, and it is critical for attachment. So in my theory or my beliefs is that attachment can't happen without co-regulation, at least secure attachment can't really happen without that co-regulation, because that's that relational bond that helps us kind of move back and forth between emotional states. It helps with the rupture repair cycle. Co-regulation is critical, and that's built right in to polyvagal theory. Um, Intergenerational trauma, the main impact that causes the transmission across generations is in attachment. So that's where your relational neuroscience becomes incredibly important. And it should also include the assessment of the impact. So if you go into a family and you haven't assessed how intergenerational trauma has affected the family across domains, you're going to run into trouble, because you're not going to have a specific tailored treatment plan in order to support that family with their specific needs. So parenting strategies that we work with clients on in intergenerational trauma really need to be based on that relational neuroscience rather than behavioral interventions, because we're finding that behavioral interventions, when there's trauma and attachment difficulties, they tend to escalate those difficulties because it causes alarm, it causes all kinds of threat, and that kind of response in the child and in the parent, that it sometimes can make it worse. So we really need to learn that relational neuroscience, attachment, co-regulation, rupture repair, all those things that come under that umbrella of relational neuroscience. You also need, because the complexity of these cases, consultation. So having somebody that you can kind of discuss cases with and get feedback is really important for applying any program, but especially with the complexity of intergenerational trauma, because there may be little difficult areas that are kind of starting to show that may disrupt therapy, but you're so focused on another aspect that you may not see this other thing that could potentially interfere with therapy. So it's always really good to have that consultation. When you have a specialist designation, it clearly communicates to clients and referral sources that you have the skills and ability to address the concerns that they have. So if you have a certification or the expertise specialization in this area, it communicates volumes to people who are seeking out those services. So now we're going to talk about increased referrals and client retention. This is so important with intergenerational trauma because there's a high dropout rate, and intergenerational trauma can affect the therapy process. So we have to be super aware of that and do specific things to help client retention and getting more referrals. So, a lot of times, therapy practices can have difficulties with attracting and retaining clients. And this may be like a skill mismatch. It could be a number of things. But when you look at intergenerational trauma, it's pretty complicated to attract and retain clients because of the impacts of intergenerational trauma. A lot of time, people who have experienced, especially the adults and caregivers in the equation or the family, who have experienced intergenerational trauma, may be very defensive in relationships and may have a lot of difficulty even thinking about entering therapy, researching a therapist, and making an appointment and going. So there's so much that goes into attracting and retaining these clients. If they're referred kind of in a mandatory sense, maybe by child welfare or child protection, it might be a little bit different, because they're kind of being told they need to be there. However, We want them to be there so that their lives can improve themselves as well. There's also a really high degree of early termination in intergenerational trauma therapy. So it's hard to retain clients if your intervention isn't efficient and effective. And this is because they have been dealing with years and years of difficulties within the family system, with dysregulation, with attachment difficulties and disruptions, that they need to feel very quickly that there's hope and there's strategies that can positively impact their experience. So they need that quick relief, not the whole picture, but they need really small bits of quick relief that build hope and encourage them throughout therapy. Another way that we can attract and more retain clients is when we have precise intervention selection, when we know exactly kind of the bullseye that will ripple out and help support getting the most relief or the most impact. That's going to be really important for the client. So, with greater expertise in treating an area like intergenerational trauma, the therapist has more flexibility to meet the needs of the client. And we can do that exactly where they're at. We can engage them, build rapport, and intervene in the most impactful way. We really want to throw to the bullseye and it ripples out to other areas in the person's life. Another benefit of increased accuracy of specialization on client outcomes is the increased accuracy of case conceptualization. So, because it's so complex, we really need to have an accurate conceptualization of what is happening in the family. And if you're not aware of how intergenerational trauma is passed between generations, complex trauma in adults, trauma and developmental trauma in children and teens, family systems, all of those big complex areas need to be a part of that case conceptualization. And we also want to have adaptive treatment plans because of the complexity. So there is a balance between being adaptive, being structured. So we have to have enough flexibility to meet immediate needs like crises, that kind of thing that may interfere with therapy or may be impacting the client. But we also need enough structure that we don't get on kind of a hamster wheel of always going after crises, because sometimes that's a defense that people have learned to keep things at a level that feels manageable and doesn't feel as threatening. So if everything's a crisis, nobody gets down into the deeper stuff and they don't have to deal with it. And we don't want to like go right into that stuff, but we want a slow, graduated descent into those impacts and difficulties. But we also want to respect that there are things that come up because of the complexity of these cases that we need to address and may need to kind of shift what we're working on in therapy. It's that delicate balance between flexibility and structure. So now we're going to look at enhanced job satisfaction for the therapist. And when we have better job satisfaction, we feel like we're making a difference, we're finding meaning in our work, we're much more effective therapists. So this directly impacts client outcomes. So we can experience huge burnout and dissatisfaction with our work due to the complexity, the difficulties making progress, constant crises. It can be really difficult to feel good about your work if you're kind of spinning your wheels and don't feel like you're making progress or you have high dropout rates. So we need to be able to have some skills and strategies to engage clients and keep them in therapy and get positive results. So when you have an efficient and effective framework to deal with these complex presentations, there's actually less burnout. So that's where that flexible and adaptive or structured is also important as well. So, in this increased job satisfaction comes from you find deeper meaning in therapy. You have these, you understand like when a parent kind of clicks and understands that a child is reacting out of an autonomic nervous state of fight, flight, or freeze and not willful behavior. That's a huge accomplishment for some of the parents that we work with. And if you're not understanding the complexity that makes that really hard for the parent to recognize that, then you're not going to really see that the therapy, like that's a monumental occasion for some families because of the lack of co-regulation that the parents have had, the impacts on attachment. It's really important to know when you're making those little tiny things that are huge wins with intergenerational trauma. We can also make specific impacts on complicated presentations. So when you know you have a very wide background in supporting and treating clients, you know the impacts, you know the interventions, you know targeted treatment interventions, and you have a great case conceptualization, it's easier to make impact on these really complicated presentations. So, and then we'll also come out as therapists with a greater sense of achievement, which is important to a lot of us. We wouldn't have gone to school for so long if achievement wasn't important. We'll also feel like we're accomplishing things, we're reaching our goals as professionals, and we'll have purpose, which really leads to more job satisfaction for us and improves the client outcomes. So, how do we know, like, how do you identify your professional development needs? How do you know what areas you need to look at and deal with so that you have that wide range of interventions and experience that you can support these complicated cases? So, because it's so complex, therapists sometimes aren't really certain about what way they should proceed with training and professional development. So there's a lot of confusion of where to start. And that's because we need to work on adult complex trauma, child and teen trauma experiences and developmental trauma, attachment and relational neuroscience, family resilience and family therapy, which is a whole field of its own. We also need to have those polyvagal theory interventions. And we need to know how to assess the impact so that we know how much impact there is and what areas to address first to have the most success in therapy. So would be a good time for you to kind of take an inventory of the areas you do have covered in training and the areas that you may not have covered in training. So I would just ask you to consider, like, where are the gaps in your training? Have you done a lot of attachment work but don't have the adult complex trauma? Or have you done a lot of trauma intervention work but don't have the family therapy background to understand the family system? So how close are you to having the areas that you feel like aren't strong as other areas? How close are you to getting a certification or more training? How close are you to having that area kind of solid in your own practice? And what are the areas that you feel uncomfortable with, or where do you struggle? So if you kind of take a self inventory of those aspects of professional training and professional development, it'll kind of help you understand where you're at and where to go. Now, if you have training in all of those areas and you're quite accomplished, you've done lots of training, um, that's great. Now you need to look at how you weave those together. So there is a risk of piecing those together because the interventions can be overwhelming to learn. You can get very scattered in your learning if you're learning 6 different areas at the same time, and you won't have a solid grasp on any one. And it's very costly. A lot of the interventions we learn have multiple workshops that we need to attend that may be $700 each, and there's like 4 to 6 to 8 of them that you need to take. So there is a risk of getting overwhelmed in training and not having solid skills and the financial impacts. So that's exactly why I developed the intergenerational trauma program, so that you don't have to piece those areas together and you have the amount of knowledge and interventions accessible to you without having to specialize in each of those areas. You specialize in the overall umbrella of intergenerational trauma. So, those are the 5 powerful impacts of specialization in intergenerational trauma therapy. We talked about the complexity and navigating that, building credibility and expertise, improved client outcomes and retention in therapy, enhancing your own job satisfaction, and identifying professional development needs. So, I actually have developed an assessment for either individual practitioners or agencies and group practices to know where is your team or where are you yourself at in the world of specialization with intergenerational trauma therapy, and what is the roadmap to get more specialized, and what do you need to do to be streamlined, efficient, and effective. So if you're interested in that, I'm not starting to offer it right now, but if you are interested, just send me a DM or a message, and we can have a conversation about that. So thank you so much for watching and listening. I'm excited for March to come, because that's when we start talking about the intergenerational resilience method. And that's just going to be so important for people to understand, to build that beginning foundation of intergenerational trauma knowledge and skills that will help you be an effective therapist. So thank you for watching, and I will see you next week. Have a beautiful day.